As you know, I'm a Hungarian. I was born in Szeged, which is the largest city and the regional center of the southern Great Plain, or the Alföld, as it is known in Hungarian. But Szeged is not famous for that. Szeged and its university is famous because it has given the world 2 Nobel Prize winners in the medical sciences field. The first one was Szent-Györgyi Albert, or Albert von Szent-Györgyi, who has received the Nobel Prize back in 1937 for discovering vitamin C. The second was more recent, Katalin Karikó, or Karikó Katalin, who has discovered and invented the mRNA vaccine with which we have managed to get through the COVID crisis. So this historical background is the native city I'm coming from, and this is also a very strong commitment and responsibility and link to the area that has accompanied me throughout my work. Irrespective of whether I worked, be it as a head of unit of the European Commission, responsible for intellectual property rights, and in that industrial property rights relating to patents and trademarks, including, of course, the ones related to the pharmaceutical area, or as Commissioner for Neighbourhood and Enlargement, where I had to support the regions I was responsible for to get through the COVID crisis, or as a public civil servant and later as a deputy permanent representative, or Coreper 1 ambassador as it is also known, where I have worked on politically and economically and financially sensitive files related to this very portfolio. It was, for example, the pharmaceutical legislation that the EU is now revising, the regulation on medical devices, or the Tobacco Products Directive, or the GMO Directive. The health policy, as you see, was always strongly present in my different career steps. With my professional history, and also coupled with the historical background of the city I'm coming from, I have to tell you that I'm very proud and honored that I was designated by President Ursula von der Leyen as Commissioner for Health and Animal Welfare. I'm also honored to have this opportunity here as Commissioner-designate for Health and Animal Welfare to present you with my vision for a Europe that is strong, that is competitive, and that is healthy. We are at a critical juncture. We need to define the choices for Europe now. Now is the time to build the Europe of the future. To make the EU an innovation powerhouse again, and focus on key strategic sectors where Europe can build a competitive edge. One of these key sectors is the health sector, be it digital health, be it pharmaceuticals, or be it biotechnology, or be it medical devices. Now is the time to cut the red tape, to shorten the procedures, to diminish costs, and to unleash our full potential, and most importantly, to help our citizens. The last mandate showed us all the benefits of EU cooperation in this portfolio. The Commission worked with this House and with the Member States to tackle the COVID-19 pandemic and to deliver a better prepared and more resilient Europe. The Commission, together with this House, has laid the foundations of a strong European health union. The Commission, together with this House, has kept the food we eat safe. The Commission, together with this House, has improved animal welfare, which is very close to our citizens' hearts. However, I'm sure we could do much more together. I think I have a very clear vision for the next 5 years. First and foremost, I want to help improve the health of our citizens by continuing to build on the European Health Union. Even though health is a member state and national responsibility, we saw during the COVID pandemic that there are health issues that we have to give joint solutions, because things like the pandemics do not respect national borders. Together, cancer and cardiovascular diseases are the leading cause of premature death in Europe. But like other chronic diseases, they are almost always or largely preventable. Prevention truly is the best medicine, because the best disease is the one you don't have. This is why we should make preventive health a priority and invest in it through a comprehensive and cross-cutting approach. Money spent on health and especially on prevention, is an investment, not a cost. Second, if the disease is unavoidable, we need a precise diagnosis, and we need the most appropriate and most state-of-the-art treatment that should be given to our citizens. I want to reassure that the necessary treatments and medicines are available to EU citizens when and where they need them. For this, Europe's pharmaceutical and biotech sectors should be at the heart of our competitive European economy. I want clinical research to stay and grow in Europe, and I want to improve the security of supply of medicines. A thriving European industry in health technologies means the EU has more autonomy in healthcare, and means also that the EU health industry can be the most competitive all over the world. This is an enabler of effective, accessible and resilient health systems that can administer the care and treatments our patients need. Finally, I want to make sure our food safety and animal welfare standards continue to be the highest in the world. I also intend to make sure that our farmers and producers can continue to provide our food and compete on a level playing field. This vision is rooted in the One Health approach, where the health of humans, animals, plants, and the environment is closely interconnected. If confirmed, I would be proud to be the Commissioner for Health and Animal Welfare, bringing together all the strands of this portfolio. But let me tell you now, how would I want to achieve this vision? A healthy Europe is underpinned by a strong and competitive European industry that delivers for our patients and health systems. The revised pharma legislation, the Critical Medicines Act, the European Biotech Act, and the revision of the medical devices legislation will be the basic pillars of the strong and competitive European industry. First, I will engage constructively with this House and the Council to reach a balanced compromise agreement on the revision of the pharmaceutical legislation. I commend this House for setting out already its position. I do hope that the Council will also be swift in developing its own. Second, in the same spirit, Europe should be a dynamic centre for biotechnology. I would lead the work to make a new European Biotech Act a reality. This act should be an enabler of innovation, which happens here in Europe. The potential is huge, especially if we combine it with the power of artificial intelligence and data created by the European data space, health data space. Within the Biotech Act, I would explore measures to boost the EU's competitiveness and to turn our world-leading science into marketable products, to bring academic institutions and businesses together and provide the connections to compete globally. This act should help us to create new world-leading health industry, which means leader in knowledge, leader in technology, leader in prevention and available therapy. We should use our data systems to gain competitive advantages with database solutions, not only in prevention, but also in healthcare, but the advancement of various biotechnologies. Third, Europe's rules on medical devices and in vitro diagnostic devices are modern and comprehensive. They put patient safety first, and the importance of this objective should never be overlooked. But I do share the view of this House that we need to ensure that the regulatory framework does not have an unintended effect by stifling innovation and putting at risk the availability of devices through overly burdensome procedures. To avoid this risk, in the short term, I would propose measures aiming to reduce burden and simplify procedures. Such measures can be achieved within the current framework. At the same time, I would intensify the ongoing work evaluating the current legislation with the aim of being ready with the review next year, keeping in mind Europe's competitiveness and efficient innovation processes. Fourth, structural dependencies in our pharmaceutical supply chains have increased medicine shortages in the EU. This situation is affecting almost all member states, putting the health of Europeans at risk. Reducing dependencies are another challenge we need to address. This is why I want to propose a Critical Medicines Act within the first 100 days as a priority action of this new mandate. I see the Critical Medicines Act as a key initiative to enhance the availability and European manufacturing of medicines and boost the EU's economic security in health, complementing the measures discussed in the revision of the pharmaceutical legislation. The Critical Medicines Act can also support innovative manufacturing technologies and can be a useful tool to create market incentives, for example, by joint procurements, to address the market failures, including also in relation to orphan drugs and rare diseases or the lack of new antibiotics. These initiatives will help us not just to complete the European Health Union, but also to lay the ground of a modernized, competitive and resilient EU health ecosystem, which will deliver for our citizens. But of course, we must not forget the resource-intensive work that is still required to implement its original building blocks. In particular, I will want to focus on making the European health data space a reality as part of a forward-looking approach to digital health, which looks to optimize the use of artificial intelligence. On health security, we require continuous vigilance through the ECDC and the Health Security Committee and full implementation of the cross-border health threats regulation. One of the biggest health threats in Europe and worldwide is the antimicrobial resistance. Fighting antimicrobial resistance requires support for innovation to curb current underinvestment in the sector, together with the creation of a market for new and more effective antibiotics and treatments developed and manufactured in Europe. I would continue the work to reach the 2030 targets, building on the important work already carried out and recognizing the connection between animal health and human health. I will devote utmost attention to keep the list of antibiotics reserved for human use up to date with the latest state of science all along the mandate. Honourable members, if confirmed, I would step up the EU's work on preventive health. Drawing the successes of the Europe's Beating Cancer Plan, I intend to propose a similarly ambitious approach for the most important cause of death in Europe, the cardiovascular diseases. Apart from reinforcing further lifelong prevention, we need better and more diagnosis and treatment. This plan the plan for European cardiovascular health should cover also diabetes, obesity, as they are closely related. Our plan should in particular help us to develop and make available new and personalized ways of prevention and treatment for Europeans, based on our work and within the European health data space. As it is the case with the Beating Cancer Plan, this new plan should also address health inequalities and focus on women's health, as the impact of cardiovascular diseases on women needs further attention. Measures in prevention would range from promoting healthy lifestyles, especially for children and young people, to regulation cuts to the root of the problems. And when it comes to risk factors, tobacco and nicotine consumption is the single largest avoidable health risk. Tobacco and nicotine products have evolved since our tobacco control rules were last revised, and new products are emerging. I would evaluate and revise the EU's rules on these products, as there are justified concerns about the young people's access and consumption, creating even more challenges for our public health. For other chronic diseases, tackling key factors like focusing on health determinants will continue, ensuring a common approach also covering neurodegenerative illnesses, autism, and other non-communicable diseases. I would also want to continue the important work of the Commission on mental health. Specifically, I would investigate the impact of social media and excessive screen time on well-being, especially for the young generation. Honourable members, new technologies present enormous opportunities to change health systems for the better. This needs to happen in a secure way, so in the first 100 days of the new mandate, I would want to work with Executive Vice President for Security, Democracy and Values on a European Action Plan on the cybersecurity of hospitals and healthcare providers. Together we are better and more able to face and solve our problems. If confirmed as a Commissioner, I would pay a particular attention. I'm running over time, sorry. I would pay particular attention to designing a balanced approach on animal welfare, aimed at finding solutions which respond to citizens' expectations and which are also economically and financially viable for farmers and which does not hinder their competitiveness. Ensuring the same standards not just across the EU, but vis-à-vis third countries on animal welfare is important and is requiring consistent implementation. And I would continue to promote high animal welfare standards at the international level. I would launch a fully inclusive consultation process that involves all relevant stakeholders, building on the report from the strategic dialogue on the future of agriculture. I would work with Commissioner for Agriculture and Food to include animal welfare in the future vision of agriculture and food. I would act on food waste and work to make food production and consumption more sustainable for our citizens. I would also want to strengthen the implementation and enforcement of our world-leading food safety standards, including for imported foods. Food safety standards in the EU ensure that our EU citizens have access to nutritious, safe and high-quality food products. I would strengthen the implementation and enforcement of these world-leading rules, including for new knowledge becoming available. I am also aware that pesticides are an essential part of the toolbox for farmers to protect their crops. Increasing the availability of viable alternatives is vital to reduce the use of chemical pesticides. Where appropriate, I intend to consider very carefully the availability of alternatives in the context of decision-making process on the renewal of approval of pesticides. I'm also committed to increasing the availability of alternatives such as biopesticides by fostering their access to market. I don't want to prolong this speech anymore, but I do want to ask for your support and offer my cooperation with you, because I think with this plan we will have a lot to deliver. Thank you.